Is the spheno-basilar compression-decompression technique. We have completed the treatment of the vertical intracranial membrane system, and now we're going to get into the horizontal membrane system, which is the tentorium cerebelli. The tentorium attaches posteriorly to the occiput, and its anterior-most attachments are to the sphenoid. So we're going to use the occiput and the sphenoid in order to accomplish this technique. I will first just support the occiput on my fingers in the back because I want to have a sensation of what it's doing. I could do this just directly on a table, but then I wouldn't have the knowledge of what the occiput's doing. My thumbs I will place over the great wings of the sphenoid, and I very gently begin to compress the sphenoid posteriorly into the table with my thumbs while supporting the occiput in the back with my fingers. And as the sphenoid and the occiput begin to approximate each other, we will be doing that latching, unlatching principle. For example, if you have a stuck drawer, sometimes it helps to push it in before you pull it out, or a jammed door. You shove it shut first real hard and then it'll open easier. Well, we're not going to shove this, but we're going to compress it gently. And as it does, any malalignments that may be present between the occiput and the sphenoid will begin to show up, as this is now. The right great wing of the sphenoid is coming towards me in the cephalad direction. The left one is going inferiorly, which means that there's a torsioned relationship between the sphenoid and an occiput, and I'm exaggerating that malposition, and it will correct as we go. Now, I'll keep going in this compression technique until I feel the head begin to soften and widen laterally. And I'm just beginning to get that sense now. So I'll keep on with the compression until it feels like it's released. She's going into a very large flexion movement now. And if you think about it, when you compress the two bones, you are enhancing flexion. There, she's gone into big flexion, and it's very nice. So now we just take a second or two, relax, and come on. Now we're going to decompress, and in order to do this, I use my thumbs to suspend the sphenoid toward the ceiling. I suspend it from my thumbs, and I lift it until I feel a lightening of the weight of the occiput on my fingers posteriorly. Once that lightening occurs, I maintain that position until the occiput begins to settle into my fingers. Then I lift some more. And I'm lifting toward the ceiling. This is a very nice compliance here. She's going up. It feels like 1/4 of an inch. Obviously not the case literally, but it feels that way. And the occiput is remaining in my fingers. So I'll keep going until the occiput lifts just a little bit. Still not lifting, and the sphenoid is going. We're going into tremendous extension maneuver here. I reposition my thumbs because they began to slip, and if you do that quickly, you won't lose the technique at all. Now we keep on going, and look at the breathing change.